conduct webinar concerning is lactation and breastfeeding management technique. While we are waiting for the some of the members to join, so I would like to welcome our Chief Executive Officer of Mindful Eating Organizations to say something. Welcome.
Greetings, everyone. I hope you can hear me properly. My name is Sarah Makweba, the Chief Executive of Mindful Eating Organization. You are all warmly welcome to this nutritional webinar concerning lactation and breastfeeding management techniques. As it was announced, it is now 18th of August. Thank you for everyone who has been able to participate. Mindful Eating has prepared this webinar so that we can all learn and we can share knowledge, because we all know that learning is a process that never ends. I would like to recognize different people, potential people who have been able to join with us in this webinar, especially our 3 key speakers for this webinar. To begin with, Madam and Nutritionist Idda Katigula from JJ Breastfeeding Organization. She's also a certified breastfeeding specialist. But on top of that, there is another key speaker who is Professor Dr. Vanisha Nambiar, convenor WBW, Vadodara Professor and Coordinator of Public Health and Nutrition Department of Food and Nutrition from MSU-University, all the way from India, together with our nutritionist, Madam Caren Shuubi Victor from Nutrition Assessment Education Council Organization from Tanzania, and other organizations together with universities and people across Africa and across the globe, from Tanzania, Nigeria, Bangladesh, and India, and so many more. You are all welcome to this webinar, and it is now officially opened. I bring back the mic to Mr. Alex, our coordinator.
Thank you, Ms. Sarah Makweba. Now I would like to welcome the first speaker start the session, because we are out of time. So I think the first speaker can start to present what she has prepared for us.
Hi everyone, can you hear me all?
Yes, madam.
Yes, we can hear you.
Okay, my name is Idda Katigula, as you have introduced me. I'm the founder of JJ Breastfeeding, but also I'm nutritionist and breastfeeding specialist. I'm based in Dar es Salaam in Tanzania. So today I'll be presenting on managing some of the breastfeeding difficulties, and also I'll tackle on the way how to hand express, and also another thing that I'll talk about, it will be on breastfeeding positioning. And the reason why is because according to what I'm doing here in Dar es Salaam, most of the challenges that mothers are facing, you find that most of our healthcare providers don't know how to help them. So I thought it would be very important for us to know. So I'm going to present my screen, and you'll tell me if you can see it. Can someone confirm? Can you see my screen?
Yes, we can see your screen, madam.
Okay. So I'll start with breastfeeding rates in Tanzania, and then we'll see we'll have to understand about lactogenesis, which is the way that our body produces milk, but also see the signs in breastfeeding. How will you know if it's not going well? But hand expression and positioning and managing breastfeeding issues. So here you'll see the data. Some of the data are coming from Tanzania Demographic Health Survey, and some of the data are coming from Tanzania National Nutrition Survey. The reason why I decided to show you this data is to understand how big is the problem and what is the progress about breastfeeding in Tanzania. So you'll see that the first one, mothers receive breastfeeding counseling within 2 days after delivery is only 36%. So, which is a very low number. That means if we have 100 mothers, only 36 mothers are given lactation support so that they can breastfeed well with their babies. And another data shows that mothers observed by healthcare providers while breastfeeding is only 35%. And you can even see children under 6 months fed complementary foods with breast milk is 22%, which is very high because we expect that under 6 months, we expect that children, they need to get mother's milk only. So you'll see that some of the children are still getting other food before reaching 6 months. And another thing is infants aged 4 to 5 months are exclusively breastfed. Why did I take this indicator? The reason why is in Tanzania, if mothers are employed, that means after 3 months, they'll need to go back to work. And you'll see that between 4 to 5 months, you'll see the number of babies that are breastfed is minimal. It's only 27%. So this is the area also we need to tackle and make sure that for working mothers or mothers who have been who are self-employed, they need to have better knowledge on how to do when they go back to work. Then children are exclusive breastfed. In 2015-16, it was 59, but last year, Tanzania Demographic Survey showed that it went higher to 64%, which is good that there is progress, but still we need to work and make sure that at least mothers can exclusively breastfeed their babies for the first 6 months. Then I wanted to discuss about what are the factors for successful breastfeeding. It's very important for us as nutritionists or healthcare providers who are here to understand which are the factors we need to put more efforts so that we can help mothers to breastfeed more. Number one is antenatal breastfeeding education. It's very important for pregnant women to have the right information about breastfeeding before delivery, because after delivery, they are always overwhelmed with information or even emotionally. So it's very hard for them to get all the information after delivery. But when you do it before, it's way more better and they have at least confidence on what they are doing. The second one is access to skilled lactation support, in which here in Tanzania, I know that we have like the guideline for infant feeding, for infant and child feeding, but when you go to the health facilities, not all healthcare providers have been trained on lactation management. It's not only about breastfeeding, but there are some issues that a healthcare provider need to help the mother so that the mother can be able to breastfeed. So access to skilled lactation support is very important because the mother will be able to breastfeed even if they have issues. The third one is early initiation within first hour after delivery. This is very important if we want to make sure that a mother can be able to breastfeed and can be able to maintain the milk supply. We need to initiate breastfeeding within 1 hour after delivery, whereby this will be attained if we do skin to skin within 1 hour, even if the mother has delivered through C-section or through vaginal birth. It doesn't matter as long as there is a system, proper system in the health facility. It will be easy for mother to do skin to skin soon after delivery. We know that sometimes there are some issues that might hinder baby and mother to be together, but at least a mother should be taught on what to do So for example, if a mother deliver a big baby, sometimes they always separate the mother and baby. You find that the mother is in the ward and the baby is in the nursery. So it's very important for this mother to be taught on how to hand express. Why? Because it will help on stimulating milk production instead of waiting for baby and mother to be together. So that's very important. Another thing which will help breastfeeding to be successful, for those mothers who are employed or self-employed, paid maternity leave and a friendly workplace for breastfeeding is very important. Imagine that after 3 months, the mother has to go to work. Then at work, they cannot maybe pump their milk because there is no place to do that. That means it's going to affect the baby who is at home. Then the mother might decide to give other type of food instead of breast milk before 6 months. So breastfeeding. Let's see about lactogenesis. Lactogenesis actually is the transition from pregnancy to lactation. This topic here, the subtopic, is very important because we as healthcare providers, we need to understand how does the milk being produced, because sometimes you might find that mothers are being pressurized after delivery to breastfeed their babies. And some of the mothers, they think that after delivery, the milk will start splashing, while it's a process. So there are 3 stages on lactogenesis. The first one is lactogenesis 1. And lactogenesis 1 is the capacity to secrete milk from mid-pregnancy to late pregnancy. And always, mother's body always during pregnancy, it starts producing milk from 16 weeks of pregnancy. That's why even the baby, if the mother gets a premature baby, they always can produce milk. And one of the signs of lactogenesis 1 is increase in breast size, which is very important on breastfeeding. That's why if mother is complaining, maybe they have milk production issues, we always ask about the increase of breast size so that we understand if there's any changes, especially on hormones and milk grant. The second stage is lactogenesis 2, which happen on day 2 or 3 up to 8, whereby this is the milk secretion after birth. And always milk little amount of milk coming out, which is called colostrum. And some of mothers are always worried, thinking that that is not enough for their babies, but apparently it is enough because it is full of nutrients, and it's totally fine to encourage the mother to keep on breastfeeding that baby without taking care of the amount of the milk coming out, especially from day 1 to day 3. If the more they keep on breastfeeding, the more the milk will keep on being produced. And this lactogenesis 2, it is always triggered by drop of progesterone and delivery of placenta. So sometimes it happens, sometimes maybe a tissue of placenta remains in mother's womb. If that thing happens, it might affect milk production. So there are so many things that you need to check if mother is having issues with milk production. And the third stage is galactopiosis, which happens on day 9, whereby it's maintained breast milk supply. Here you'll see the mother is telling you, now my breasts are full, now I'm getting a lot of milk. And here the supply depends on demand. That's why it's very important for the mother to keep on breastfeeding frequently, so that to stimulate the body to produce milk. And breast decreases between 6 to 9 months is postpartum. So it's normal for mothers to expect that their breast size will decrease. It will not be the same as maybe when it was 1 month postpartum. So these are the signs that breastfeeding is not doing well. You find that the baby is sleepy and maybe has had less than 6 feeds in 24 hours. So when you meet with the mother, it's very important to ask some of the questions to see if the baby is too sleepy. If you find, for example, a 1-month-old and the mother is telling you, my baby is sleeping for 4 or 5 hours, then you should be concerned because it's not normal. We know that there are sleepy babies, but at least the mother needs to wake that baby to feed. Then another thing that will show you breastfeeding is not doing well. Baby feeds for 5 minutes or less for each feed, or sometimes baby has jaundice. Jaundice is the condition that happens in some of the newborns, whereby you find that their eyes are yellow or their skin are yellow. Sometimes it can be triggered if the baby is not getting enough milk. And another sign is baby refuses to breastfeed. So sometimes you might find the mother is telling you that my baby cannot breastfeed. The baby refused at all to breastfeed. So you need to be concerned. Why baby refused to breastfeed? Is it because of nipple issues, or what is the reason? Another thing is nipple pain and cracked nipples, in which apparently in the community you find that even some of the healthcare providers, if the mother says, okay, but I'm breastfeeding my baby, but I'm feeling pain, some they'll tell them, that's normal because it's your first time. It's not normal. So nipple pain and cracked nipple, that means it tells you that even the latching, the way baby is breastfeeding, the way baby has been positioned is not in a good way. So even the milk transfer will be low. So we don't expect the baby to gain weight here. But less wet diapers. So in the first 3 days, we expect that the baby will get maybe 1 to 2 or 3 diapers of pee, of urine. But when they reaches 5 days, we expect that they'll get at least 6 diapers in 24 hours of urine. That one will tell you breastfeeding is doing well. But if the baby is getting less than that, then we need to find out what is happening. And if the mother cannot tell, or you cannot tell if the baby is swallowing at day 3 or 4 post-delivery, then you should be concerned. There are satiety cues. How will you know that the baby maybe is full? They always close mouth. They might turn head away from breast after breastfeeding for some time, not after 1 minute or 2 minutes or 5. Then they relax their hands. Always when they are hungry, they always make a fist, a very hard fist where you cannot open. But when they are full, they always their hands are always relaxed. You can even open their fingers easily. And some of the signs that we need to understand that will tell you that baby is getting enough milk is baby is getting wet diapers. Wet diapers, that means the baby is getting urine, as I've said earlier. Baby gains weight from day 10 to 14. Here it's very important. We don't expect baby to start gaining weight day 2, day 3. They always lose weight, at least 7%, and maximum is 10% of their birth weight. And we expect them to return to their birth weight on day 10 up to day 14. Okay, from there they can start gaining. So it's very important to encourage and tell mothers so that they can understand. Then you can hear audible swallowing. When the baby is breastfeeding, you can hear that the baby is swallowing. That means they are transferring milk from breast to their body. So I said that I'll tackle on some of the issues, especially that some of the mothers have. There is inverted nipple. Inverted nipples are, it happens when mother's nipple is inside of the breast. So you find that the baby cannot latch, cannot breastfeed well because the nipple is inside. And this is biological. There are some ways that we need to help this mother. First, we can use the pump. It can be a manual pump, or it can be electric pump or nipple puller, at least for 1 minute to pull the nipple, then try to breastfeed the baby. Also, there's a way that we can hold the breast. As you can see the second picture, you can see how the breast has been held. We call it sandwich. It's the same as the way you are eating maybe sandwich. So when you do that, it is easy. You are creating a space whereby a baby can grab the breast and latch. Also use breast shell for 30 minutes. And breast shell, they help the nipple to pop out. So it will be easy for baby to latch. And sometimes if everything is not working well, we sometimes try to use the nipple shield, whereby the nipple shield, it needs guidance from the healthcare provider so that the mother can know how to use it and the baby can transfer milk. As you can see from the picture on the left, that is inverted nipple. and the light, that's normal nipple shape. And sometimes it can be flat. As you can see, the inverted one, you can see that sometimes some of us, we have flat nipple. It's not inverted, but it is flat. Also, it's an issue. So managing flat nipples, it's very important to demonstrate teacup hold, whereby you find that when assume that you're holding a small cup. So the way you're holding a small cup, a mother can hold the same on the alveolar, the part where it's dark. That way it will be easy for the baby to grab the breast and breastfeed. But also the positioning. It's very important to demonstrate football and laid back. Laid back, it's when the mother lays way far back and the baby comes on top of her. So that it will be easy for the baby to latch rather than sitting the cradle position, the normal position that we know. There will be gravity. So the gravity keeps on pulling the baby. Now the baby cannot latch well because the nipple is flat. But if everything is not going well, then encourage the mother to hand express or pump so that to feed the baby. And feeding the baby after delivery, they can use cup or spoon instead of the bottle because the flow of the milk from the bottle, it might be fast. And if the baby knows that the flow is fast, they always prefer bottle from breast. So you find that breastfeeding is not, baby will never want to breastfeeding from the mother. Also here we can use nipple shield. If everything doesn't work well, we can use nipple shield to assist for some time. Then if everything goes well, after some time, we can wean off. Then we have nipple pain. Nipple pain, as I've said, it's always due to incorrect latch. When I say latch, is the way that a mother, is the way that the baby touches on the breast. If they attach on the nipple only, they'll keep on sucking the nipple and it will be uncomfortable. And sometimes mothers can have wound and it's unbearable to breastfeed. So it's very important mothers can understand how to latch their babies. As you can see that image, it's very important for the nipple to point between the nose and upper lip. If you do that, babies have reflexes whereby it stimulates them to open their mouth wide, as you can see. When they open their mouth wide, it's easy then to latch. We call it the correct latch or deep latch. And if the baby latches well, that means there will be less pain and it will be easy for baby to transfer milk. So whenever you meet with a mother and the mother tells you that I have nipple pain, my baby cries a lot, just know that the issue is the nipple pain. Now we need to collect the latching, how the baby is being positioned, how the baby is attached on the breast. That's very important. And if the mother has maybe wound, they can use salt solution for 2 minutes, whereby they mix 1 teaspoon of salt into 250 ml of warm water and dip their nipples for maybe 1 to 2 minutes. Then they can apply nipple cream or coconut oil and air dry so that the wound can heal. Also, there is another issue. Sometimes mothers have edema on the areola. Edema is when the dark part of the breast swells. And most of the time we find the mothers who deliver through C-section, they always have that issue due to fluid that have been given through IV. So if this part is swell, that means baby cannot latch. It becomes hard. So we need to reverse. As you can see, the fingers, they're on top of the alveola. So we need to reverse so that we push the fluid back and baby can latch well. And if everything is not going well, it's better to hand express and feed the baby. Then after that, you can do cold compress. You can encourage the mother to use something which is very cold to do like massage for relief. Another issue is engorgement, whereby for engorgement, It happens when the milk transfer is not good, especially if the mother has a nipple pain or baby cannot latch well. So you find that the mother is struggling to breastfeed, the baby keep on touching the breast. That means the breast has been stimulated, milk is being produced, but milk is not taken away from the breast. Maybe baby is not breastfeeding well, or mother is hand expressing but not well. So if the breast become full, it is painful, and sometimes they can even have fever. So what they can do is, first they do a massage for 2 minutes, then hand express for at least to empty the breast, but don't empty the breast, at least to get the relief, then the baby can breastfeed. If doesn't work, then it's better mother to be encouraged to hand express and feed the baby by cup or spoon. Then after that, we do cold compress for few minutes. The cold compress is very important because it will minimize the inflammation, the pain that the mother is having. Or you can use it, the mother can even use frozen cabbage leaves for 1 day, and repeat the process until they feel much better. And another thing that I wanted to tackle, I have I think 1 or 2 slides to finish, hand expression. So hand expression, always it's an issue, and pumping. Most of the time, mothers, they always complain the way that they've been assisted on hand expression. You find that people hold the nipple while expressing the milk, which is not okay. It's very painful, and the milk will never come out. So find the mother is telling, I've even tried to express, nothing is coming out. Maybe because they didn't hold it properly. So it's very important the fingers to be back of the areola. We should not express on the nipple. So always the mother needs to put the fingers behind the areola, not on the areola or on the nipple, because it's very painful. And latching, I think I've said about this, about latching. We point the nipple between nose and the upper lip, then the baby will open the mouth wide, then it should be easy. It will be easy for the baby to latch. For breastfeeding positioning, as you can see on the picture, there are different positioning, and each position is very important, because sometimes, let's say we have a mother who was delivered by C-section, they have pain. If they have pain, imagine you're forcing them to sit down so that they breastfeed. They're uncomfortable, so the breastfeeding will not go well. So it's very important to breastfeed the baby according to the situation. So if the mother can breastfeed while side-lying, then we can do that. This is side-lying. This is a cradle position. This is underarm. The underarm is very important and easy for babies who are very small, like premature babies who have started breastfeeding, or small babies, or if the mother has a small breast, we can use this position. We can even use this one, the cross cradle, and this one is the laid back. And laid back, it's very important for mothers who have nipple issues like flat nipple, inverted nipples, and even the small babies, they can use that position. And the last one is managing perception of low milk supply. This is the thing that we have seen that when you go to for example, for me, I do lactation round. You find that the mother is telling you, I don't have milk, but we need to understand the history behind the perception. Is it that the first baby, they didn't have milk? That's why the second baby, they're saying that they don't have milk. So another thing is very important to take mother's history. Just know if they had hormonal issues, did the breast increase in size, do they have like diseases like that? Are they diabetic, or do they have hypertension? So it's very important for you to know that, so that before you do any counseling. Then explain about how milk production is done. That's why today I discussed about lactogenesis, so that you can even have ability to explain to mothers. Find out if there's any pain, and if there's any pain, please assist them on how to position the baby, and take baby's history and feeding pattern. These 5 things will help you to manage the perception of low milk supply. Then it will be easy for you to know which way you should do to help this mother. So after that, thank you so much. I know that I'm out of time, and if there's any question, we can connect here. If there's any question, I'll be willing to answer. Back to you, Alex or Sarah.
Thank you so much, Madam Thank you so much, Madam Ida, a nutritionist from JJ Breastfeeding and breastfeeding specialist. It was a very good presentation. We have all learned and we have gotten very good information from what you have just presented. Thank you so much. Questions will be offered at the end of the webinar in case of no changes will occur. I would love to welcome our second speaker all the way from India, Professor Dr. Vanish Nambiar, convenor, WBW, Vadodara, Professor and Coordinator of Public Health, Nutrition Department of Food and Nutrition in MSU-University. You're welcome. Please feel free.
Thank you so much, Sarah. And if you permit me, I would like to share my screen.
Yes, you may share your screen. It's permitted.
Thank you. 1 minute. 2. Certainly. Why is it not happening? It is open. What's wrong with it now?
No, it has not shown up.
1 minute, please.
Okay.
Is my screen visible?
No, it is not yet visible, Professor.
Is my screen visible now?
No. Yes, it's starting to present.
It is?
It's visible.
Okay,
Yes,
thank you. So thank you once again for the invitation. And Alex, who is one of the organizer, is one of our student, our international student in our Maharaja Sayajirao University of Baroda, which is situated in Vadodara, Gujarat, India. And today I'm going to talk about issues and concerns of exclusive breastfeeding. And I am very happy to share my thoughts along with two very, I think, passionate nutritionists from Tanzania, that is Caren and Ida. So I bring to you greetings from the Maharaja Sayajirao University of Baroda, which is in existence since 1881. And this is our beautiful campus, and I invite everyone to come visit our university, collaborate and work with us, and also come here as a student if you can. The theme for this year's World Breastfeeding Week, as suggested by WABA, is enabling breastfeeding, making a difference for working parents. And these are the objectives of WABA, which say that you have to inform people about working parents' perspective on breastfeeding and parenting. You need to anchor optimal paid leave and workplace support as important tools to enable breastfeeding. You also need to engage with individuals and organizations to enhance collaboration and support for breastfeeding at work. And the moment Alex said that we are doing this mindful eating and it is an organization of young people, I said, let us engage. And that's the reason why I am here. Also galvanize action on improving nutrition conditions and relevant support for breastfeeding. Now, so much on breastfeeding is already very beautifully put up in the recent Lancet series, which is a very reputed journal. And all the participants, I request them to download this entire issue. It is free. And it says that only 1 in 2 newborn are put to breast within 1 hour of life. That first hour, which is the golden hour, is very, very important. It also says that 1 in 3 babies in low and middle income countries are given fluids other than breast milk during the first 3 days of life, and practice which increases the risk of breastfeeding failure. In the previous presentation, we learned about different techniques of feeding, but the failure will happen if you do not put your child within 1 hour of birth, and also if you keep on feeding your child other things besides breast milk. When you look at the Indian data, over 1 lakh preventable child deaths are there. And there are other causes of deaths, but we will mainly focus on preventable child deaths. And if you do not breastfeed the child initially, then there are cases of pneumonia, diarrhea, and of course, non-communicable diseases are also a big problem for children who are fed infant milk formulas. So, coming back to this year's theme, for working mothers, breastfeeding is crucially important, but increasingly challenged in that infant milk formula, which is a market-driven world. So let's understand physiology of lactation. Now you know that these are the 2 hormones, prolactin and oxytocin, which are important for lactation to happen in the body. Okay, so prolactin helps in production of milk the moment the mother gets pregnant, and as the pregnancy proceeds, the prolactin helps in production. But though the milk is inside the mother's breast, it is oxytocin, that hormone, which helps in injection of milk. Okay, and they're also obviously 100% connected by the reflexes of the baby. We learn different positioning. So rooting of the baby, the suckling, the swallowing is very, very
Excuse
important.
me, ma'am.
Yes.
Ma'am, your PPT is not shared.
Not shared?
No.
It is shared. That is what it is. I'm so sorry. I have shared, and 1 minute. I did say it is. Can you see the screen? And you said it is.
We're not seeing the slides yet.
You could not? Oh, I'm so sorry.
We were seeing your screen, but no, not the slides.
Can you see my slides now?
No, we're not seeing your screen yet.
It
Okay,
is showing
shared.
shared.
Yes, now we can see.
Okay. Sorry about that. I just quickly run through my slides. Can you see my first slide?
Yes.
Hello? Is it on full
Yes.
screen now?
Yes.
Yes.
You are able to see the slides?
Yes.
Yes, madam.
Yes? Okay. So this was my first slide. This was my second slide, which said thank you to organizers and to my 2 different panelists. And this is the slide and the picture of my university. Can you all see it?
Yes, madam, we can see.
Okay, thank you for response. I'll keep asking so that I know that both of us are on the same page. And this is this year's theme for the World Breastfeeding Week, which was celebrated from 1st to 7th of August. Okay, and these are the 4 objectives of the World Breastfeeding Week, which are given by WABA, which is inform, anchor, engage, and galvanize. Okay, and this is a picture of the Lancet series, which talks on breastfeeding. So the entire series has over 8 papers, and they all talk about the different aspects of breastfeeding. Okay, and this is the data which I shared. the country which I breastfeeding, which is crucially important but increasingly challenged in the market-driven world of the infant milk world. Okay, and this is where I talked about physiology of lactation. So, is this slide visible? Physiology of lactation.
Yes, it is visible.
Thank you. And I spoke about two hormones which are very, very important to feed. We are talking about lactation. So these are the two very important hormones. First is prolactin, which helps in production of milk. Second is oxytocin, which causes the ejection of milk. So even if the milk is there in mother's breast, if she is not relaxed, then there will not be correct lactation. And also the positioning of the baby, which was taught by previous speaker, that is rooting of the baby on mother's breast has to be correct. Only then suckling and swallowing will happen, and that will lead to growth of the baby. Okay. I also spoke about prolactin reflex. There are many factors which hinder the prolactin reflex, that is ejection of the milk from the mother, which is delayed in the initiation of breastfeeds. Many mothers who have done cesarean section deliveries, they do not feed the baby till 3 or 4 days. Then there is prelacteal feeds. That means you give sugar water, you give honey, you give other stuff, but not breast milk. Then you make the baby wait for feeds. You have to do demand feeding. Okay, you don't say that, okay, I have breakfast at 7, then I have lunch at 12, then I have dinner at 8, so I will also feed my baby at the same time. The baby, when you need to see the signs, the cues of hunger, and keep feeding the baby. Do not give all those dummies and pacifiers or bottles. And also certain medications are contraindications for the breast milk, so that has to be stopped. And then there are painful breast conditions which have been explained by my previous speaker. So let's look at the prolactin milk secretion reflex. Can you all see this diagram?
Yes.
Yes.
So this talks about when there is enough prolactin in the blood, and that enough prolactin in the blood will keep on happening more and more the moment the baby is rooted properly and the baby sucks, there is expression of milk, there is night feeds, and there is complete emptying of one breast before the child is put to another breast. And the hindering factors of prolactin are bottle feeding, incorrect positioning, and very painful breast. Oxytocin, milk ejection reflex, that oxytocin contracts the myoepithelial cells of the breast. Okay. And as the moment the baby suckles, there is a sensory impulse from the nipple to the brain, and that will help in ejection of the milk. Okay. So to summarize, this oxytocin reflex is stimulated by loving the baby, thinking or thought of the baby, sound of the baby, sight of the baby. So the previous speaker spoke about skin to skin contact, kangaroo mother care. So that is the reason why the baby is supposed to be close to the skin of the mother or the father or the grandmother there in the family for a long time, at least 1 hour. Therefore, the baby feels there's no hypothermia, and also there is warmth. And if the mother is available, then skin to skin should be there with the mother only. And the mother should not be worried, or she should be stress-free. She should not, if she's in pain or if she's in doubtful condition, then oxytocin reflexes are inhibited. Okay. So to sum up, rooting reflex is very, very important. And the rooting is in the entire black area, the areola, not just the pointed nipple. Okay. So what are the issues and concerns? Breastfeeding is very natural. It's a physiological process. The cows don't have to do infant milk formula for their calves. Okay. The moment a baby is born, the mothers naturally will be able to feed the child. However, many mothers are having feeding problems because of poor secretion or sore nipples or breast engorgement, and this hampers optimal breastfeeding. The common breastfeeding problems I'm repeating it again, are sore nipples, breast engorgement, plugged milk ducts, low milk supply and overabundant supply of milk. Okay, so what are the various gaps? The mother may be having a first child. She doesn't know how to do the positioning of the baby. She's not able to do early initiation of breastfeeding within 1 hour. Maybe the baby separated from the mother. The delivery by cesarean section where the mother has stitches in the body. She's in the hospital. She's anesthetized, so she's not in proper senses. She already has a catheter. She's in pain. So during that condition, it is the lactation support or the mother or the father or whoever is there, that person is supposed to put the baby on mother's breast, because the mother's breast is not anesthetized. The mother is anesthetized. So milk is available in the mother's breast. So somebody has to help to do the first hour of feeding for such mothers. Then there are preterm babies, the low birth weight babies. The normal birth is 2.5 kilograms. Okay, but if it is less, if the babies are born before 36 weeks, then maybe the baby is not developed. So if the baby is not in the incubator, if the baby is not in NICU, then there is definitely a whole lactation support group is needed to feed such babies. Then twins, but there are methods to feed even twins. Of course, home deliveries are now becoming less and less in India. I would like to know the status in Africa. But even during home deliveries, proper lactation support can be there. Pre-lacteals, water feeding, and pacifiers are the usual. Now, some of the common questions. How do I know that my baby is getting enough milk from breastfeeding? So the answer is, at birth, a newborn stomach is only the size of the thumbnail, this much, and it requires a very small amount of milk per feed. As you keep breastfeeding, the stomach grows and the milk supplies grows. So the common concept is we will have a whole glass of milk to feed the newborn baby. The baby does not need that much. Okay. The second is, my nipple hurts when I'm breastfeeding. So what do I do? So you don't have to feed the baby at the nipple. You have to ensure that the mouth is wide open and the entire areola inside the mouth of the baby. That is the sign of attachment, a good attachment. Okay. So of the various positions of breastfeeding that were taught earlier also, the cross cradle position, the center one, is supposed to be the most effective, most commonly practiced, and the other positions are cradle positions, football hold, laid back position, and side lie. Okay. Now, breastfeeding is not the sole responsibility of mother, women, but it is society's collective responsibility. And that is why even people, even men, even young boys like Alex are taking interest in organizing such events, because it is not a single person's responsibility. Also, we have to now talk openly about correct positioning, about correct physiology, about anatomy, and it is a science. So government and health organizations as well as healthcare systems have understood the value of breastfeeding. They have understood the value of first 1,000 days of life. And therefore, everybody is putting in so much of effort, funds, as well as resources to ensure that the baby gets his first vaccine, which is breast milk. Okay. So how do you ensure this? So there are 10 successful steps of successful breastfeeding. And these are hospital policies, staff competency, antenatal care, child right after birth, and so on and so forth. And we will be discussing them one after the other. Of course, there are a lot of challenges, and the challenges as well as these policies have been very well documented by UNICEF and World Health Organization, and I'm going to discuss them one after one. The first one is the hospital policy. Now, if the gynec who actually delivers the baby does not bother to feed the baby within 1 hour of birth till the neonatologist arrives in the hospital, then all the game is lost, because that first hour, the golden hour, is very important. And therefore, the hospital policy has to be there that you are not promoting infant formulas, bottles, or teats. Also, breastfeeding, making breastfeeding care a standard practice has to be done by hospitals, and keeping a track of whether there's support or not is also very important. The second one is staff competencies. Do we have enough people to train the newly delivered mother? If not, give them a training during the antenatal care. Train the staff on supporting mothers, on train even their families or whoever is the caregiver of the mother, so that the breastfeeding within 1 hour of birth happens. The third one is antenatal care. When the pregnant mother comes to the gynec, during that time, discuss the importance of breastfeeding for babies as well as for the mothers, and prepare the mother how to feed the baby properly. Okay. Also, there are many other challenges. Suppose a poor nutrition status of the mother or sick mother. So you have to assess the nutrition status of the mother. You have to also see the fluid and water intake of the mother, and you have to keep on reassuring the mother. At the same time, if the baby is passing enough urine, if the baby is gaining enough weight or sleeping nicely between two feeds, that means the baby is well fed. Also, importance of demand feeding is there versus timely feeding. Every baby is different and every baby's hunger is different. So please ensure that there is demand feeding. The fourth part is the hospital support mothers to breastfeeding and what kind of care is given. The first important care is the skin to skin contact. The mother and the baby have to be in contact, skin to skin, no clothes in between. And that helps the mother put the baby to the breast right away. Okay. The fifth point is support the mothers to breastfeeding. Check the positioning, check the suckling position, and give practical support and help and cure and solve the breastfeeding problems. Next is supplementing. Now, hospital supports to breastfed by giving only breast milk unless there is any other medical reason. Many doctors have seen, we have so much of literature and we have own studies which have reported that the mothers are not given breast milk. They are given infant milk formulas because the nurses are too tired to even teach the mother how to feed the baby. Okay, so that should not be the case. Next is rooming in. Earlier, if you have visited the hospitals, there will be one cot of the mother and the cot of a baby. Now that other cot is vanished from India. I don't know about Tanzania. But the mother and the baby in India, they are all on the same cot. That is, rooming in has to be there. And also, the whole day as well as night, the baby is supposed to be very close to the mother. For very sick babies also, the mother can visit the NICU at least 2 or 3 times a day to assure that, to see whether the child is okay. Responsive feeding, know the cues of hunger. Understand when the child is hungry, and that should be helped by the doctor or the lactation counselor to the mother. No bottles, no teats, I've already spoken. And then once the mother goes home, there has to be a lactation support post-discharge also. There has to be small groups, communities, or the contact numbers have to be shared that if there is an issue, whom to contact. Now, what have we done in India? Recently, during the World Breastfeeding Week, we took a pledge. We took a pledge that all the 10 steps of baby-friendly hospital initiatives have to be followed by all the obstetrics and the gynecologists of this city. And these baby-friendly hospital initiative is a worldwide initiative given by UNICEF as well as WHO. And we made them do this pledge. And I hope scenario will change. Now let's look at the preterm baby feeding. Babies having birth weight between 1200 to 1500 grams and a gestational age between 30 to 34 weeks, if they are stable, then you feed them through a tube using expressed breast milk, okay, using mothers, generally mothers. If the mother is very sick, then probably take the milk from the milk bank. If you don't have a milk bank, take the milk from another nursing mother, which is called a vet nurse, okay? But try and give mother's milk. Do giraffes or do elephants or do cows take other animals' milk? No. So humans should be having human milk only. And babies having a weight between 1500 to 1700 grams and a gestational age of 34 to 36 weeks can be fed express breast milk using a cup and spoon, because they're little better, they're grown better, and they can have a suckling from their mouth. And if the baby is preterm, but the weight is more than 1700 grams and the age of more than 36 weeks, directly can be put to breast. So how do you feed? Different methods are there. The first one, of course, directly putting on the breast. The second one is called the gavage feeding. That means there's a syringe, a small little syringe, depending on the birth weight and the age of the baby, the amount of milk expressed from the mother is given through the syringe from a pipe to the mother's mouth. Next is cup, spoon, katori spoon, or palada feeding. So it's like a small little vessel, which is shown over here. And then non-nutritive suckling, that even if the milk is not there, keep on doing a non-nutritive suckling so that the suckling effects keep happening. Okay. So what are the various gaps in the mother or the child? The primaries, they don't know. There's lack of awareness. They do not understand the protective effects of breastfeeding against childhood illnesses like diarrhea and pneumonia. The benefits of the breastfeeding for the mother's own self is not understood. Different positions and latching positions are not known. Also, they don't understand that even a C-section mother can do timely initiation with the help of a lactation support. And also, they do not understand that you do not have to give pre-lacteals and what are the negative effects of bottle feeding. Therefore, it is timely that we invest heavily in maternal, infant, young child nutrition for sustainable development. You know that there are 17 sustainable development goals. So whether it is no poverty or zero hunger or good health and well-being for all these three goals are followed by the fourth one, which is education, is all related to MIYCN. You have to promote healthy diets, both pre, peri, and periconceptual guidance and lactation management, form support groups, and ensure to enhance the competency of health professionals and managers in the implementation of various policy guidelines set up by UNICEF and WHO, which the whole world follows. Now, this is my beautiful faculty of Family and Community Science, which has 5 departments, and one of the department is Department of Foods and Nutrition. And on the top is the hospital, our university's hospital called the SSG Hospital, Sir Sayaji Rao General Hospital, and it has a Baroda Medical College where we do our practicals and our research work in the maternity homes. And with this, I thank you once again to the organizers. I hope I have maintained your time, and I'll be happy to take questions because I'll be leaving in the next 5 minutes. Thank you so much.
Okay, thank you so much, Professor Dr. Vanisha Nambiar. Thank you so much. Okay, due to the fact that you'll be leaving in the next 5 minutes, I'll allow a few questions towards Professor Dr. Vanisha Nambiar. To the audience, anyone with a question, you can just raise your hand and try to unmute your mic and air out your view for your question. Anyone with a question? Or you can write it down.
You can write in the comment sections if you have any comments, or
you can write it down in the message box. Okay, as we'll be waiting, we'll give 5 minutes for people to write down their question.
okay, I think there's no one who's typing right now. So it's actually post my office hour, and if you would permit, I would like to take leave from all of you.
There's a question here from Linda says, can you kindly give input how nutrition influence mothers allowed to share breast milk in the world?
How good nutrition influence successful breastfeeding? Of course, that's a great question. So, Linda Nani, did I pronounce correct? So if the mother is not healthy, there is always a chance of preterm baby. That means she delivers before time. Also, because of less gestational age, the weight of the baby is not correct. So there is always a chance that the baby has to be kept in NICU. We have seen 1 kg babies, we've seen 800-gram babies instead of 2.5 kg babies, because the mothers are so thin. They first 2-3 months they do not realize that they're pregnant. Then by 7th month, the baby's out, and the baby is so small. So if the mother is not nourished, there is always a chance of less weight of the baby. That's point number 1. Second point is the baby is anemic. That means she doesn't have enough hemoglobin in the body. Okay, so 11.5 is the correct value of hemoglobin, but she doesn't have that, and because of that, she may lose a baby. She may also deliver a baby which is of not good health or conditions, low birth weight babies, or she may lose. There are many deformities that can happen. So therefore, nutrition status, especially protein, calcium, iron, good quality of fat, type 1 nutrients are very, very essentials during pregnancy. Also, one of the major consequences, as I had mentioned, non-communicable diseases in my first few slides. There is a Doha theory, which is given by David Barker. Okay, it's also known as Barker's hypothesis, which very clearly says that if mother does not get correct nutrition during pregnancy, the child by the age of 5, 6, 10, or even 20 years is definitely going to get insulin resistance, because during pregnancy itself, the baby has not got correct nutrition. So there are chance of non-communicable diseases to a baby, to a fetus, which is growing in the mother's womb and not fed well. So I see another question on hiccups. Can hiccups be drawn from back position during latching? No, I am not an expert in this. Maybe a pediatrician can answer, or somebody else who's there in the presentation can answer. But I will not be able to answer this because latching does lead to less suckling, less milk inside the baby's body, and poor growth of the body. Then there's another question: what are the appropriate and possible means of feeding a preterm or a low birth weight baby? I have shared in my slide, depending on the months of the baby and the condition or weight of the baby. If the baby is above 1700 grams, then definitely you can put the baby on mother's milk, on the mother's breast. Otherwise, you can do gavage feeding, that is feeding with the help of a pipe, and the milk is pumped through a syringe. Okay, and there are some babies who have good reflex, so they are given through palada or cup and spoon. But very small babies, very preterm babies, so there are preterm babies also have 3-4 categories. So very, very preterm babies, they have to be fed in through the tubes only, and depending on the call, they can be given mother's milk also. Okay, so then the next is, breast milk is known to contain necessary nutrients for the child. What if the mother is malnourished? Yeah, I have told you already that the breast milk composition does not change much whether the mother is malnourished or not, except a few fatty acids. The breast milk composition of a well-nourished and a malnourished mother remains the same. That means even if the mother is undernourished, the breast milk composition, the baby will suckle out the nutrients out of the mother's body. And therefore, repeated pregnancies, the mother is depleted of calcium, protein, iron. Very, very important that there is gaps in pregnancy. Very, very important that the mother is well nourished before she's pregnant. Okay. Then what if mother is having breast cancer? What are the appropriate way to breastfeed the baby? See, this is a very complicated surgical question. If there is breast cancer, depending on the physician's advice, only the pregnancy happens. And after that, before in the antenatal checkup itself, there is counseling and a decision is made whether you will be able to feed the baby or not. Okay. So the physician will take a call on this.
There was also another question from Madam Ida that was asking, are mothers allowed to share breast milk in the ward?
Which one?
From Madam Idda Katigula. It's a bit on top.
Sorry. Thank you. Are mothers allowed to share breast milk? Of course, yes. I spoke to you about the concept of wet nursing. Wet nursing was very popular in India ages ago. When if I am ill, I'm not able to feed the child. If somebody else has enough breast milk, can definitely feed my child. So it is wet nursing. Also, expression of breast milk. Now in Vadodara, India, where I am staying, we have 2 milk banks. Okay, so there are many mothers who can produce enough milk even besides after feeding the baby. There's so much of milk. So those mothers are encouraged to go and donate their milk in the milk bank through the pump or hand expression, but normally through the pump because it's faster and it's less painful. So that milk is stored, and whoever needs, the other babies whose mother is sick or having breast cancer, is not allowed to feed the baby, is on certain medications because of her conditions of ill health, are fed breast milk. But try and give human milk to human babies is what my message is. Okay.
Thank you so much, Professor, for a wonderful presentation. And thank you so much. We have also known about a little bit about India and where you're coming from, the university and everything. We're so thankful for what you have done for us. Well, we can now allow you to.
Thank you so much. Namaste from my end. It was a pleasure to interact to you all virtually, and I invite you to my country, my beautiful India, and namaste once again. Thank you so much.
Thank you. Welcome to Tanzania too. Namaste.
Yeah, and Alex will be there from my department. So Alex, please make notes of everything, and I would be happy to share any other questions later on. Yeah, thanks a lot. Bye-bye.
Goodbye. Thank you.
You're welcome, madam.
Okay, well, we have learned a lot from our second speaker. We're running a little bit out of time, but we would like to listen from our third speaker. Our third speaker, that is nutritionist all the way from Tanzania, Madam Caren Shuubi Victor, who will be sharing to us a special topic concerning breastfeeding and also pregnancy. Welcome, Madam Caren Victor.
Thank you. Can you hear me?
Yes.
Okay. So I'm not going to show my face right now. I will at the end, and I'll put off my camera for for other reasons. But you are going to see me at the end. Okay. So, Ida, don't laugh. Ida, you're laughing. Okay. So let me begin. First of all, I'm so happy to be part of this. I congratulate every one of you who saw the importance of having this webinar. Yeah, it's good. Sometimes we need, as ourselves, the professionals, we need to speak and update each other and get to learn from one another. Yeah, so, well, we had the breastfeeding week and we saw the theme, and that theme is the theme that I really like. Why? Because so the other years that had passed, the theme only based on the mothers that maybe are in the village or are in the underdeveloped places, or those who don't go to work, or sometimes it's only we only had to speak about being breastfeeding, being in the hospitals and all that. But we are forgetting that breastfeeding should not be the reason women have to stop working, or working should not be the reason why kids stop breastfeeding. Yeah, so that's a very nice theme, and I will explain a bit about what I wanted to talk about, but I'll walk in that theme. Yeah. So as I always say, breastfeeding is something needs to to be prepared for during pregnancy. Oh, by the way, did I introduce myself? I don't remember. But I'm a pregnancy nutritionist. Yeah, so I've chosen to specialize and work with pregnant women and breastfeeding mothers. Yeah, so that's where I lie. Yeah. So breastfeeding needs to be prepared during pregnancy. Why? Because as other speakers spoke, you also all those challenges that they spoke about and explained. But okay, those challenges that were explained by my fellow speakers. Now, if a mother has the education she needs, the lactation education she needs, maybe it is going to be easy for her during breastfeeding. For example, in our community, for those who are in Tanzania, I don't know how it works in India, but in Tanzania, we have so many traditional myths and things that are not scientifically proven. And those are the things that our grandmothers know, our mothers know. That is the information they already have. And no one gets a chance on, if it's not so many people, but we still have a gap that these, our grandmas and our mothers have not been able to get the right education that they need. So when a mother gives birth, most of the time she has people to help her. And the people that are going to help her, maybe it's her mother or the mother-in-law or the grandmother. And now, remember, those people, they have the information from 80s, 90s there. Yes, when a baby cries, what they know is the baby is hungry. When the baby cries, your milk is not thick enough to make the baby full. When the baby cries, yeah. So there are so many things that are still making it for mothers. Because imagine you are a new mother. You are at your mother-in-law's house. You get it? And it happens that you don't have this education, you don't know anything. Sometimes when you are educated and you know you have to do when this happens during breastfeeding, when he cries, what do you have to look at, and all that. When you know that, it's easy for you to argue and stand and have a stand. But if you don't, you are going to follow on what you are being told by your mother-in-law or your mother or your grandmother. So there comes difficulties during that time. So we need to be able to reach more women. In Tanzania, we are only few people that deal with breastfeeding. A few, at least those I know. Ida, myself, and some very few who are professionals. So we need more for those who are listening and pursuing nutrition. This area should not be left out. Everyone is running to pediatric nutrition, but this, we are leaving it out. And it is very important because it's still in the first window of opportunity, the 1,000 days, you see. So when a mother is pregnant, she needs to get the whole education about, okay, what happens the day, from the first day, what do you have to prepare? You should have breast pumps, if you can afford one. If you don't, then you should know how to press the milk using your hands. Ida has already explained that. Also, you should have a lactation counselor. You get it. As so many people know that you find even those families that have money, you find they have family doctors, but they don't have a nutritionist. You understand? So we need to put more energy on advocacy so that people can see they need us. Yeah. So when a mother is pregnant and she's preparing for birth, she should be able to have a nutritionist, a consultant, a lactation consultant who will be there to help her, because there are so many challenges, as they have already explained. If you don't know what is going on, you can panic or sometimes you can even get, a mother can undergo postpartum depression, things that can be avoided. Yes. So should be that. I mean, during the preparation for birth, a mother should prepare herself with a skin-to-skin plan. You understand? So they should know that you have the right to go to the hospital and talk to a person that is going to be there the day you are giving birth. So she or he, whoever, has to take you through, and the mother should know that she has to ask for that. The skin-to-skin is very important, and it's very crucial for initiation of breastfeeding in the first hour. Even if a mother had undergo C-section or vaginal birth, she deserves that. That is the golden hour. We call it a golden hour. Yes. But it happens that so many women don't get that, and they don't even know if there is something called skin-to-skin. They only know it is for premature babies. That means we also have a gap on that. Yes. And another thing, these women who are pregnant and going to become mothers, to make breastfeeding easy for them, they need someone to help them. If a mother comes from the hospital, she should not have other responsibilities to take care of, so that she can begin to focus only on her baby or babies if she has twins. Yeah. So if the husband has the education he needs, if the house help, if they don't have one, then they should know that they need to get one. For those who are in the facility, and for those who have the chance to meet other women who are pregnant, that should be one of the things you have to talk to them about. Some might think it's easy, but it is not. It happened to me, so I know. And sometimes it's hard. You find a baby is crying. You don't know what to do. You are all alone. You just get confused. The baby cries, you also cry, and forget that you are the mother who should make sure your baby calms down. So you start also to cry. That's where the emotions and build up. You find yourself in depression, which is not right. So to reduce all this drama and all this stress, a mother should make sure she has someone to help her. The help is not necessarily a mother or your mother or your aunt or your relative. You can hire. There are other people who do that. It's their job. Some people have decided to take that seriously, and that is their job. So you can look for those and hire them for a while. Yeah, babysitters as you go along. You have someone to help. You can't do everything. So if you have someone to be there, that will make it easy. But you also need to be very careful in choosing who is going to help you after you give birth, because your health might be the reason you get postpartum depression. As I said, our mothers, our parents, those who didn't get a chance maybe to be educated, or did not get the chance to get this breastfeeding, lactation education, they have what they believe, and that is what they know. And it is not easy for you to tell them otherwise. Some of them don't even believe in expressing milk, storing milk, everything they don't. A baby cries and you say the baby is just maybe fussy because of the gas and all that. They don't believe that. They only have their perceptions. Now, if you, a first-time mother, you are in that situation, it is going to be hard for you. Some I've seen from experience, some women in my classes, because I have classes of pregnant women, I have already given them everything they need. All the education they need, even after birth. Now the problem comes to the introduction of what they have already learned. She knows this. The mother-in-law knows this. things become opposite. It gets hot. If the husband doesn't also know, is going to side with mother. I'm going to give you an example. It's not an example actually. It is a story that I got from one of my mothers. There's this lady. She gave birth, and that day, as Idda said, Idda has already spoken about the first days after giving birth. The milk doesn't come out like the other days. Yes, it comes out little, but that doesn't mean that it is not enough for the baby. No, it is enough according to the size of the stomach. Now, this woman had that first milk that comes out like water, and the mother-in-law was, she said that milk is not enough, you see. So what they did is they started preparing porridge for that baby. The baby had only 2 days. You get? The woman is in my classes. She already knows that that is not what is supposed to be done. And actually nothing should be done because as the milk, it is small, yes, but it is enough for the baby. Now, I had to speak to her. She called me crying, and she said, my mother-in-law wants to give my baby porridge. You see, for those in Tanzania, what they do in that porridge, they boil the porridge, then they sieve to get it thin, so that the baby had 2 days, remember. So I had to ask her. She came very frustrated. Then I had to ask, what does your husband say in all of this? She said, my husband is siding with his mother. So she had no one on her side. Then I asked her to give me husband's number. I got the number, and I had to speak to that man for an hour. I thought he's a very educated man, very, very educated. And he listened to me like an hour, and what he said, my mom has, we are 7 of us, and that is the she raised us, and that is how my son is going to be raised. You understand? That day, my mood was over from all of that. I felt so bad for that woman because she already has the education she needs, and she knows that is not good for her child, but she has no one to support her. So we need to go. I've given you all this story because we need to see from a different perspective. Not only the mothers need the education. We need to go down until to the other generation. You understand? Those people that are going to be there for us to give birth should not be the reason why we are going to be frustrated, or our babies are going to get the things they don't need to get. And let alone that, when the baby is fussy, gassy, others, the wabibi, the grandmas, they will run and look for traditional medicines. We don't know what all of that brings to the baby. So we need to make sure, even if a mother tells you she has someone to help her, you need to cross-check who is that someone. If possible, call them and talk to them before this woman gives birth. That will help a mother, even if she's well educated on lactation. It will be easy for her to implement whatever she was taught by a lactation specialist. So looking back to the theme of this week, women, not women, all of us, the mother, the father, everyone should know that going back to work to most of people is not an emergency. It's something that you know the day you give birth. For example, in Tanzania, women know that after 3 months, you're going back to work. So the day you give birth, you already know the day you're going back to work. You see? So when you go back to work, you need to think, before going back to work, you need to think, how are you going to leave this baby? what is going to be done, should be done, what is this, and what are the things that you need to buy, you see. So there comes this, expressing milk and storing. Ida has spoken about that, but people don't know that that is possible. They don't. So we need to put more effort on that. So during those the first weeks, when a baby is not able to breastfeed well and latch well, sometimes you find the milk is high, but the mother, the baby is not able to latch properly or suck the milk properly, or it cannot have high, too much of it. So the mother finds herself in a situation of maybe getting engorgement. Yeah, so she can start from there as early as possible. You start expressing milk and store, so that after 3 months, when you have to go back to work, your baby has the milk she or he needs. But also, you need to get support from this person that you're going to leave the baby with. Make sure you have time to educate them so that you understand and they understand how to feed the baby, how to warm the milk, what is not to be done during all that time. So we have a lot of people that need to be given all of this education that we are talking about. So I think I'm almost done with all of this. The last thing, when pregnancy is something that most of us, it should be planned, but most of us don't plan it. But breastfeeding can be planned. So this should be a new normal. During pregnancy, a mother should know. And those who say they don't have money, maybe their cash flow is low, remember, you have to go through pregnancy for 40 weeks for most of the women. In those 40 weeks, if you're going to buy a breast pump, which the normal is, those which are manual start from 25,000, and those electric, maybe double pumps, go to 75, and those wearable pumps go to 145,000. So this mother has time to prepare for a very good breast pump. So they should not make excuses. If they really want this thing to help, and for us who are their counselors, you should make sure you put some senses into them, because people don't see these things as important as we see them. So we should make sure when we talk to them, explain things to them, we should make sure they move from your office well trained and they know what they're supposed to do and the importance of everything that you have given them. Yeah, so yeah, that's it. Thank you so much for listening. Yeah, so it's time to finish. I was in close, so it was hard for me to see.
Thank you so much, Madam Caren. Thank you so much for the wonderful presentation.
Okay, so if there are any questions?
Okay, this time that is left, may we please put in our questions. We can unmute our mics and air out our questions to our speakers, who nutritionist Madam Idda Katigula and Caren Victor, who are still with us. Anyone with a question? There was a hand before Madam Caren had finished. Anyone with a question, you are free to ask. You may just unmute your mic and you may air out the question. Okay, there is a hand. Madam Ida?
Hi. So, nilitaka kuonyesha, I wanted to show you about the nipple shield. When I was talking about nipple shield, I think many people didn't see. So this is the nipple shield. A mother who has nipple, maybe flat nipple or inverted nipple, sometimes we have to use it to help those mothers. So I wanted to make sure that everyone can see it. And I have a boob here, okay? It stays like this, okay? So that's it, Sarah.
Okay, thank you. Okay, anyone else with a question? There's a question from Mr. Gilbert Gaston. He's asking what foods should be avoided when by a breastfeeding mother. What foods should be avoided by a breastfeeding mother? Madam Ida? Yes, Madam Ida, you can answer us.
Karen, I can see Karen wants to talk maybe.
Oh,
She
Oh
can
no,
go.
you can speak. I'm just on. I'm looking at the questions in the chat.
Okay, so the food that should be avoided basically are drinks which has a lot of caffeine, because caffeine can pass through breast milk and can even interrupt sleeping to the baby. They can have like abdominal issues, maybe the birth. And another thing that should be avoided during breastfeeding is alcohol. I know in Tanzania, some of the regions, when you go to the villages, you find that some mothers are given alcohol. They think that it stimulates breast milk, but it doesn't, because it interferes the oxytocin level. And as the professor from India said, the role of oxytocin is to release breast milk, to make sure that the milk comes out from your body. So if a mother takes a lot of alcohol, it's going to affect breastfeeding. Another thing, there are some herbs which might affect milk production. They're not common in Tanzania, but I know some of people, they use it. For example, it's called sage. I'll write it here. There is sage, there is parsley, and another thing is peppermint. So if a breastfeeding mother is taking a peppermint tea, it might affect milk production. Back to you, Sarah.
okay, thank you so much.
Sarah, can I say anything? Something.
Okay, welcome, Madam Karen.
Okay, so I wonder why in Tanzania, to be specific, why women who are waiting to give birth are always told to drink tea with so much concentrated tea. How do we? Okay, tea leaves. As I know, when it is that concentrated, has high caffeine, and that can affect the milk production. Yes, there are other teas that are okay, but I wonder why do they tell them that? That is something we should also look into. And someone asked something about the foods that a mother should eat. And what did he say? Let me check here. He said on the charts. Okay. And for the food which can increase production, we have to be realistic. Some of our mothers, they can't afford the mentioned above because of availability and finance. We have to think of those not in town. Personally, I encourage to take hot drinks, include hot porridge, but also we try to invest time to talking to mothers. Okay. Now we should know kwamba this the milk production, food yes has an effect on that, but not so much. Like the hormones, the two prolactin and oxytocin, those are the most important. And the mother needs to get a balanced diet. Even if she's in the village, she eats maybe rice, meat, vegetables, and fruits. She's good. She's very good. Yeah. This, yes, the porridge, yes, we like it for the women and all that, but it's not necessarily. It doesn't mean if she doesn't get that, she won't get milk. Just give her a balanced diet. Give her the peaceful environment she needs, no stress. Then you'll see the breast milk will be there non-stop. Yeah, thank you.
Okay, thank you. Yes, Madam Ida.
Okay, so I just want to say thank you to Caren about that, because I think in the community, many people, they think that if the mother needs to produce milk, they need to take a lot of liquids. But I insist it should be balanced diet. And some of people, they think that balanced diet is expensive. I encourage us as healthcare providers or professionals to encourage mothers or parents or families to use the food that they have. For example, if they can afford to have maybe rice and beans and spinach, and maybe they have orange, that's balanced diet. So a breastfeeding mother doesn't need to take a lot of uji or let's say the porridge or mtori here in Tanzania for them to produce milk. That's very important for us to understand. They just need nutrients, and the nutrients comes from balanced diet.
That is a very good addition. Also, I used to have this, I don't know, it's a myth or is it supposed to be that way that whenever a mother has given birth, has to gain weight, has to become fat, and sometimes they become obese or overweight. How can you say about that? Is it really supposed to be that way, or it can be otherwise? Thank you.
Ida, are you going to answer that?
Yes, I'll start, then you can go. So,
Okay.
Sarah,
Yes.
I'll talk this by experience, but also looking from other countries what they are doing. Okay,
Yeah.
here in Tanzania, I can say it's tradition and culture. Okay, it comes from our mothers, our grandmothers, that especially let's talk about the northern part. They believe that for a mother to be healthy and the baby to be healthy, a mother to need to gain weight. Okay, that's
Yes.
why you find that a lot of mother in some of the areas, they gain weight because they are given a lot of food. They are overfed. The food that they need, it's not that they are given a lot compared to what their body needs. What we need to understand is that after delivery, the mother needs more 500 calories on top of everything that she was eating before being pregnant. Okay, so the issue here is we need to give education to family members, to people in the community, so that they understand what are the things that are supposed to be done. Even when we go back to the Tanzania Demographic Health Survey, you will find that
Yes.
some of the regions have issues on obesity, like they are leading on obesity among women. And when you go back, it's how they are eating after delivery. Okay, so
Yes.
the thing is myth, but also traditional and culture. So if we need to change the thing, it's more of behavioral change. So people need to be educated, but we can never go there and tell them you need to eat like this. They need to understand. So we need to go to the community and educate them. We need to educate our mothers, our grandmothers. We need to educate our healthcare providers and everyone in the community so that they understand how should it be done. I don't know if I've answered you, Sarah.
Yes, you have answered me. Thank you so much. We really need to change this mentality that everyone has in their mind. Okay, I'll take two more questions. There is this one that Gilbert is asking, is there a relationship between physical exercise and breastfeeding?
Caren, you can take that.
Okay. Okay, physical exercise, that is a term that is very general. But as the person, either pregnant or not pregnant, breastfeeding, not breastfeeding, exercise is important, but doesn't mean and yes, it comes okay, for a mother after birth, maybe we should speak about that. For a mother after birth, she has to go with light exercises due to the fact that maybe she had stitches, she's not properly healed, but after 6 months, I mean after 6 weeks, she can go on and go to the gym and all that, but doesn't affect the breastfeeding. But if she starts early, it can affect her healing process. She needs to go slow. For a person who's going to the gym, you can't come from the hospital today and expect you to go to the gym tomorrow. That is toiling yourself.
Okay, thank you, Madam Caren. There is also another question from Rahabu Kigali. What is the main advantage of skin-to-skin contact between the mother and her child? And the mother with the skin problem after birth, is she allowed to do the process? Yes, Madam.
Yes. Okay, Ida. Answer that.
Yes, Madam Eden.
Okay, I'll say something, then Caren can say too. So basically, skin to skin contact is very important. It's one of the foundation for breastfeeding. Soon after delivery, the hormones changes in mother's body, and always the oxytocin level goes higher, and the prolactin level goes higher, and for mother's body to maintain the oxytocin level to be the same, it needs there should be a skin-to-skin contact between the mother and the baby. And the smell of the baby makes the mother to relax. And when the mother is relaxing, it means that the oxytocin release more. And if the oxytocin release more, that means when the baby starts sucking, it will even aid that the milk to come out from the breast, okay? The release of the breast milk. Another thing is for regulating body temperature for the baby, okay? Another thing is for regulating heart rate for the baby. When the baby can feel heartbeat for mother's heartbeat, can feel mother's smell, it makes them relaxing. And when they're relaxed, it's easy for them even to concentrate on breastfeeding more, rather than when they're separated. So skin to skin contact, it's very important and vital for breastfeeding. It's like a foundation. And I think Gilbert Gaston has said in the chat, I think some of the people can live there. And another thing is, I think he said that if a mother has skin to skin, has skin issues, okay? I think it depends on type of skin issue that the mother has. So it's very important to discuss between professionals in the hospital and see if that skin issue can go to the baby. And if it can go to the baby, I think it's easy even to wrap on mother's body something which is very thin, whereby it can even transfer the heat from baby and mother. So that's my opinion.
And for
Thank you
those
so
children
much.
that are born, oh, okay. And
Yes,
for those
Madam
children
Caren.
that are born preterm, those who are born before time, the skin to skin is very important with what Ida said, but also very important in the weight gain of the baby. That's why there is that kangaroo style that a baby is, it's now the kangaroo is not necessarily the mother's skin, but in breastfeeding the mother's skin is the one that is necessary. But on the kangaroo, to get the heat and help the baby gain weight, that can be on anyone, the father, the auntie, the whoever. That's why a few weeks ago in Tanzania we saw that woman who was providing, actually she was volunteering to give skin to skin contact to those kids that maybe their mothers died, or they give birth to a child and they leave the baby there at the hospital. They just leave the baby. Yeah. So yeah.
Okay. As we take our last and final question that asks how to help a lactating mother who's whose child has refused breast milk? From Prudence Muta.
Okay, now refusing breast milk as a lot. From my experience, some women tell you that the baby has refused taking breast milk, but she doesn't give you the real truth about how did they get to that extent of the baby refusing. And some of them, it's just because maybe when breastfeeding, the positioning of the baby, if she doesn't position the baby well, maybe the baby will be struggling during breastfeeding, or sometimes they press them on the head, and for that is painful to a baby. Then if he or she finds it very hard, or breastfeeding not as enjoyable as as it has to be. And sometimes they get nipple confusion because of giving them the 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 bottles that have fake nipples. So when the baby breastfeeds from that bottle with such a nipple, becomes easy for them to get the milk than on the breast, because they don't need so much energy to suck the milk from the bottle. So from there they get nipple confusion. Then they might refuse to feed from the breast. But also sometimes, if the breast maybe has infection, if the taste of the milk can change, then that can be the reason. But from my experience, and Ida will say, from my experience, most of the women don't say the truth about about what really happens, and others tend to give the babies the formula milk. Now, the formula milk tastes different from the mother's milk, so the baby can try to choose. So I don't want this. I want this. Yeah, so that also can be a reason. Ida can add more if she has, but that is what I know.
Yes, Madam Ida, I can see your hand is up.
Okay, thank you, Caren. I think you have said it all, but I'll add on. Sometimes some mothers have strong letdown. Strong letdown is when the baby is sucking and the milk is coming so fast, so baby cannot control it, and they decide to refuse to breastfeed. Another reason is when the babies are sick. When they're sick, if they have issues, sometimes they might refuse to breastfeed. And if the mother doesn't know what is happening, then you find that the mother is trying to force the baby to breastfeed. And the more you force the baby to breastfeed, the more they refuse. So that's it. Back to you, Sarah.
Okay, thank you so much. I will allow this moment because we are out of time. For Madam Ida, together with Madam, she has gone offline. She has gone offline, but we would love that you may share your emails from the chat box. Madam Caren, yes, she's back. We are kindly asking that you can share your emails in the chat box in case of anyone who will have a question that can ask you personally, and I am sure that will not be, it will be lovely. Thank you so much, Madam Ida. I can see it is there. Thank you, everyone. I know we have a lot of questions. We had a lot of questions, and I believe that we have both learned very much through this section and this webinar. And there's more that we are supposed to learn about breastfeeding. This is just very short. It is a broad topic that it has to be discussed. It has to be educated to other people outside, especially in local areas. There is a lot of myths that people have about breastfeeding, about pregnancy, nutrition, and everything. So we are kindly saying thank you so much for our speakers, and we will invite you more and more in Mindful Eating Organization to give us details and to give us the knowledge that you have. And I would like to thank you, each and everyone who has been able to join from Tanzania, from Nigeria, from India, from Bangladesh, and from all other countries in this world. Thank you very much. I'll now return this mic to Mr. Alex. Mr. Alex, you may proceed if you have anything to add on.
Thank you,
Ms. Sarah Makweba. I would like to say thank you to everyone who has joined, and it's pleasure to see the contribution to each speakers. We have learned a lot, and we wish you a good luck to everything you have done to us. Thank you a lot.
Okay, then I will wind up this webinar. Thank you so much, our speakers. If you have anything to add, anything to talk before you leave, you are now welcome, but we have already allowed you to leave the webinar. You're welcome, Madam Idda. You're welcome, Madam Caren. Okay. Our speakers, you're allowed. You're allowed now. You can leave the meeting and okay, Madam Caren, you're on.
Oh, okay. So we are leaving. And you
Yeah,
guys are
I wanted you to talk anything before you leave.
Oh, okay,
Because
okay.
I know that you're making supplements for breastfeeding, and yeah, it's a very good opportunity that we can all know about your.
Oh, okay. Okay, so I have classes for pregnant women and breastfeeding women. And I also have classes for women who want to lose weight after giving birth. I have that. And I also have classes for pre-pregnancy. I have I have okay, I sell breast pumps. Yes, I sell breast pumps. The breast pumps I was talking about, and now I have those breast pumps that you can wear in your bra, and you don't touch it. It does the work itself. So for a person that is very busy, that is a breast pump to go for. And I also have breast okay, not breast. How do I put this? Okay, milk boosters. I have milk booster powder and milk boosting tea. So those are some of the few among the 7 products that I have. For those who want to know more about what I do, you can go on Instagram on my page. You just write pregnancy nutrition TZ. Yes, and my other line of business, you go like Tiffany and Mommy stores. And my other line, you go like tea hair products. Yeah, so the hair products are for babies and mothers who are from giving birth. You know, they get the hair losses and all that. Yeah. So I have a lot of things. If you come to my page, you're going to see all of that. Yeah. Yeah. Thank you. And
Thank
I'm
you.
so happy. Thank you for you guys inviting me on short notice. But yeah, because the knowledge is in the head, yeah, it's okay. But next time, please let me know earlier. Thank you.
Thank you so much, Madam Caren. Thank you,
Okay.
and welcome again to Mindful Eating.
Okay. Bye.
Okay, bye. Thank you, everyone, for being with us and participating with us in this webinar. We have enjoyed learning this wonderful session, and welcome again to Mindful Eating. You can check us on our Instagram account at Mindful Eating. Also in our LinkedIn, as Mindful Eating Organization. I can see Madam Idda is back online. Yes, Madam Idda, do you have anything to say before we wind up our webinar?
Sarah, I'm sorry, I think I had connection issues, but I
Yeah.
want to thank you so much for this opportunity, and thank you for everyone to ask questions. I believe this will be ongoing because breastfeeding education is highly needed. Many people need to understand about breastfeeding issues. So if anyone has questions, please feel free to reach out. I'll be happy to help you or answer you. Thank you.
Thank you so much, Madam Idda. Well, we may all now be able to leave the webinar. It is now officially closed. Thank you all for your participation. Thank you so much.